Good evening. It's Monday, November 16th. Thanks for joining us. I'm Maya Trabulsi. A 19-year-old asylum seeker from Honduras gave birth in Border Patrol custody this weekend, setting off fears of another family separation. KPBS reporter Max Rivlin-Nadler is live in Chula Vista outside of Scripps Hospital, where the asylum seeker and her child are being kept. Max?
Maya, the 19-year-old was taken into custody last week near the San Ysidro port of entry. She gave birth while in custody on Friday. She grew concerned when Border Patrol agents told her that she couldn't make any phone calls and that she would be returned to the local police barracks, the local Border Patrol barracks, while her child was kept here at the hospital. That's what set off fears about a possible separation. Once back in Border Patrol custody, the mother could have been placed in the Remain in Mexico program and sent back to Mexico while her child stayed in the U.S. Yesterday afternoon, I visited the hospital as 2 Border Patrol agents guarded the room with the mother inside. A Border Patrol supervisor told her lawyer that there would be no separation, but fears were raised anew when Border Patrol officers showed up this morning carrying a baby seat. This afternoon, a Border Patrol spokesperson told me that there was never any plan to separate the mother and child. The mother has been given a notice to appear and has been released from Border Patrol custody. The 2 of them should be taken to a local shelter at some point in the near future. In Chula Vista, Max Rivlin-Nadler, KPBS News.
Thanks, Max. Striking for better pay and increased mental health services, Kaiser Permanente workers across the state are again walking the picket lines. KPBS reporter Matt Hoffman explains why caregivers are hitting those picket lines in San Diego.
Kaiser, you can't hide. We can see your greedy side.
Part of that statewide strike is happening right here in San Diego at the San Diego Medical Center. You can hear lots of people out here supporting the workers that are striking here. Basically, they're asking for more mental health services from Kaiser. They're saying that their patients are being neglected.
When we can only get them in once a month or once every 2 months, it really prolongs their suffering and really prevents us from being able to do the work that we know how to do.
And if we don't get more staffing soon, we'll be marching till next June.
Dozens of mental health clinicians were picketing at the Kaiser Hospital in Kearny Mesa, demanding more staffing and benefits that match other Kaiser workers.
And the fact that they have never yet agreed to treat us the same as the rest of their employees, it proves to us that Kaiser still has not made the commitment to improve its mental health services.
Kaiser says it has hired more than 500 therapists since the beginning of the year. A spokesperson says it's doing its best while there's a national shortage of qualified professionals.
They are not offering those same terms to our mental health professionals, so it's hard for mental health professionals, I think, to consider Kaiser as an employer when they see basically that we're being retaliated against for speaking up about this issue.
Kaiser greed has got to go.
The strike was organized by the National Union of Healthcare Workers. Members also walked out last December. They feel demonstrating is the only way to get what they want.
We've done so in the past, and that's what has proven to push Kaiser to increase our staffing. The problem is, though, that Kaiser continues to grow and to add more patients. And while it adds adequate staff in other departments, we always have to push Kaiser to do that for mental health.
Those striking include therapists and psychiatric nurses who work with patients dealing with a variety of mental health issues.
Certainly the most common forms of anxiety and depression, oftentimes both. Certainly, yes, addiction problems.
Kaiser, can't you see? This is a healthcare emergency.
Workers say waiting 2 months for an appointment is simply too long.
In order for treatment to help, it's very well established that we need to be seeing patients weekly or every 2 weeks.
Caregivers plan to continue striking across the state this week unless a deal is reached. Kaiser officials say they're working through a mediator on a compromise, but the union walked away from the negotiating table.
This is NUHW's 6th notice strike within a single year. We believe that NUHW's repeated call for short strikes is disruptive to patient access, operations, and service, and frankly, irresponsible.
During the strike, mental health services will still be available at Kaiser, although some appointments may have to be rescheduled. Matt Hoffman, KPBS News.
And just north of us, another labor dispute is hanging over this week's Democratic presidential debate. Food service workers at Loyola Marymount University have been working without a contract since April. Their dispute is with a company contracted by the LA University, not the school itself. However, all 7 candidates say they support the union and won't cross the picket line. The Democratic Party says it's encouraging all sides to work out a resolution. It's scheduled for Thursday night here on KPBS. So much for a quiet week heading into the holidays. The next few days will be historic and consequential in Washington, and the big impeachment vote in the House is just part of it. Nadia Romero breaks it all down for us.
The New York Stock Exchange opens up for the first day since the U.S. and China agreed to a Phase 1 trade deal, as lawmakers plan to vote this week on the U.S.-Mexico-Canada agreement.
We are putting together historic, and I mean historic, trade with USMCA, Canada, Mexico.
Lawmakers are also busy focusing on multiple spending bills to keep the government funded. The House is expected to vote Tuesday in order to give the Senate time to pass it before the clock runs out after Friday.
I wanted to get this done when the Democrats brought another continuing resolution up. I wanted to get this done so they could get paid, our military men and women, and get their raise. I wanted to get this done so our nation could be stronger.
The Judiciary Committee will come to order.
And now the full House is expected to vote on articles of impeachment against President Trump sometime this week. With Democrats holding the majority, they're expected to have the votes to impeach the president. So now, Senate Minority Leader Chuck Schumer is looking ahead to the Senate trial.
I went to Mitch McConnell 2 weeks ago and I said, let's negotiate. Let's sit down and try to come up with a fair process.
But first, lawmakers have at least 3 votes that must happen by Friday, or it may impact their expected holiday break. In Washington, Nadia Romero, KPBS News.
And looking ahead for Wednesday, KPBS will have live coverage of the House impeachment vote. It's scheduled to start at 6 a.m. Pacific time. You can watch, listen, and stream live on all of our platforms. As Congress also considers the big trade agreement between the U.S., Mexico, and Canada, one country might be having second thoughts, and that could mean uncertainty for getting USMCA past the finish line. Matt Rivers explains.
With the strokes of 3 pens, a new USMCA trade deal was signed last week in Mexico City. More than just a trade deal, though, for the U.S., it was a moment of rare bipartisanship. Though it still needs to pass Congress, Chief Negotiator Robert Lighthizer called it a model for future trade deals. President Trump called it historic, and House Speaker Nancy Pelosi agreed.
It's a victory for America's workers. It's one that we take great pride in advancing.
U.S., Mexican, and Canadian negotiators first agreed on a new deal last year, but House Democrats had several concerns, including about Mexican labor. Through a year of negotiations with the White House, they demanded that any deal included changes in Mexican labor law, with Americans on the ground in country making sure the new laws were followed. The bill now being considered by the House says that labor attachés will be based in Mexico, quote, to monitor and enforce the labor obligations of Mexico. The problem here, the Mexican government now says nobody told them that.
No fue por razones evidentes.
This provision was not consulted with Mexico, said Mexico's chief negotiator Saturday, and of course, we don't agree. As a part of this deal, Mexico did change its laws to make it easier for workers to unionize effectively. But when pressured during negotiations to accept outside inspectors at its work sites, Mexico long balked, saying they only agreed to participate in dispute resolution panels. Undersecretary Jesus Seade tweeted Sunday in part, quote, Mexico will never accept inspectors for a simple reason. Mexican law prohibits it. Seade says he will meet with U.S. Trade Representative Robert Lighthizer in Washington today. So does this mean the entire agreement is in jeopardy? Experts tell CNN probably not. For one, Mexico's Senate overwhelmingly approved the deal last Thursday, and the strong response from Mexican President López Obrador's administration over the weekend could simply be about domestic politics.
He wants to have that image that Mexico stood firm during the negotiation.
Plus, Mexico's economy isn't doing very well, and USMCA might help with that.
Can Mexico afford to scuttle this deal?
No.
The U.S. House will likely vote on and pass the pact this week, but this is a 3-country deal. If Mexico were to walk away, the entire thing could collapse. And even if that's not likely, what we do know is that the agreement that looked ready to sail through Congress, that President Trump tweeted, quote, will be the best and most important trade deal ever made by the USA, just got a lot more complicated. Matt Rivers, CNN, Mexico City.
Two Trump administration healthcare officials have been caught in a public feud. Health and Human Services Secretary Alex Azar and Medicare and Medicaid Chief Seema Verma were called to the White House to work out their issues. CNN's Renee Marsh has more.
So thank you all for joining us, and I'll now hand things over to Administrator Verma.
The bitter battle between two of President Trump's top healthcare officials is now out in the open. Health Secretary Alex Azar and the Medicare/Medicaid head Seema Verma.
I think it's extraordinarily unusual for two top-level people in the health space to do so. You know, we've heard of these types of internecine battles before, usually in the national security space between state or DOD or the NSC.
It's been a series of tit-for-tat incidents. A source close to Verma described the clash. Azar undercut her plan to replace Obamacare. Verma slammed his plan to lower drug costs right in front of the president. Then Azar tried to keep her from flying on Air Force One to this Medicare announcement championed by her team.
We are making your Medicare even better.
Azar's aides, according to Politico, said there was no room on the plane. The two also feuded over who would become Verma's chief of staff. That prompted a gender discrimination investigation by outside counsel that found no evidence of wrongdoing, the source said. Verma reports to Azar and her allies believe he undermined her decisions in ways he would not for a man. One criticism of Verma is she had no prior experience running a large government agency. A former department official who speaks with current staff said Verma is also criticized because she prioritizes her brand and sidelines key staff from decision-making. The Department of Health and Human Services would not respond to specific questions about the feud, but said, quote, Secretary Azar's and Administrator Verma's top priority is to advance the president's health care agenda. Adding fuel, a series of embarrassing headlines about Verma spending $3 million tax dollars on public relations firms to boost her profile, and a request for $47,000 in reimbursement for stolen jewelry and belongings while on a work trip. The department defended Verma, but an internal audit is underway.
The fact that these two people who are charged with implementing health care policy are at odds with one another, certainly isn't helping the administration.
And that's the larger problem for the Trump administration.
Wow! We're going to win with health care, repeal and replace that garbage known as Obamacare.
Trump's most ambitious health care promises, like replacing Obamacare and lowering drug costs, are stalled. A former agency official and a Verma ally told CNN they partially blame the feud.
And for now, it appears the two will keep their jobs with a low-level feud still expected to continue. At least 1,300 people have died from the flu in the U.S. so far this season. That's according to new estimates from the CDC. It released a preliminary estimate for the season on Friday. Health officials reported 2.6 million have contracted the flu so far. Of the flu-related deaths, 10 of the victims were children. Last week, every state except Alaska saw a significant spread of the virus. So far, at least 7 people in San Diego County have died from the flu. Outside temperatures dropped below 45 degrees last night, so the San Diego Housing Commission activated the inclement weather shelter program for the county's homeless community. Father Joe's Villages is able to shelter 134 people from the cold or wet weather, while Path San Diego Connections housing downtown can accommodate 30 people. Jesse Mendez is manager of residential services at Father Joe's, where he says they can house 14 family members at their location on Imperial Avenue in one of 3 multi-purpose areas.
Street families come in, or families that are living on the streets, and they come in. We try to accommodate them as soon as possible. We've never ever had to turn away a family, and I don't think we ever plan on it. They show up, we do their intakes just like everybody else, and we get them their locations to sleep, provide them the mats, cots, blankets, so they can dinner also, so they can have a warm place to sleep in the night.
And the City of San Diego funds the program at Father Joe's Villages, while the San Diego Housing Commission funds the program at Path San Diego Connections Housing. And for more on those chilly temperatures and rain on the way, let's go to meteorologist Regina Miller.
Well, the setup for today, we've got a big area of high pressure interior locations here, and because of that, we're seeing the winds that are going to be intensifying for tonight and through the day today, but especially for late tonight into early tomorrow morning. And because of that, we do have a wind advisory in effect, and that's until 10 p.m. on Tuesday. So the areas that will be impacted the most here are going to be the coastal slopes of the Santa Ana Mountains, also ridge tops here in San Diego County. So the peak winds are going to be late tonight into early tomorrow morning, and we could see peak gusts of 50 to 55 miles per hour in some of those areas. A slight shower chance possible on Wednesdays. We have some moisture disturbance that will kind of work its way through Southern California. Now in San Diego for today, we're going to see mostly sunny sky for the afternoon. Then tonight, 47 degrees under a partly cloudy sky. For our overnight in Borrego Springs, we dropped to 38 degrees, and we'll have to watch for those strong gusty winds. In Mount Laguna, 31 degrees as well, and in Oceanside, 37 for tonight. Tomorrow, we'll have windy conditions early, and they will subside a little bit as we go through the afternoon. And Borrego Springs, 60 degrees, Mount Laguna, 44, Oceanside at 67 degrees. Along the coast, we'll have mostly cloudy sky on Wednesday. There is a chance for perhaps a shower on Wednesday or Wednesday night. Thursday, mostly sunny skies with a high of 65, mostly sunny on Friday, warmer at 69. Inland areas, mostly cloudy for you on Wednesday as well. There is a slight shower chance here on Wednesday. Thursday, mostly sunny. Lots of sunshine on Friday and getting warmer into the low 70s. In the mountains, 45 with a mostly cloudy sky on Wednesday. That chance for perhaps a shower. And then Thursday, mostly sunny, warming up a bit on Friday to 53 and then 56 by Saturday. And Wednesday in the desert area, 62 degrees, mainly cloudy, mostly sunny for your Thursday and also Friday. I'm Regina Miller, KPBS News.
San Diego City Council members today approved a ban on motorized scooters being ridden on the city's boardwalks. The ban applies to the boardwalks in Mission Beach, Pacific Beach, and La Jolla, as well as the Mission Bay Walkway. Residents have complained of reckless and unsafe riding in those areas. City Councilwoman Barbara Bree proposed the ban, saying there were parallel streets and alleys where people could ride. Opponents of the ban argued those parallel streets aren't safe for riding because they have no bike lanes. 2 years ago, California legalized the purchase and sale of recreational marijuana. Since then, the state has collected hundreds of millions of dollars in taxes from the cannabis industry. As part of our series, High Hopes, California's Pot Experiment, KPBS Metro reporter Andrew Bowen examines where the money goes.
But you'll be able to use that for everything.
David Moncada is meeting with a counselor at Family Health Centers of San Diego. He's in their intensive outpatient program for drug addicts.
One of the rules I chose was to have 5 years or more sobriety.
A few years ago, Moncada was a homeless meth user who frequently got arrested. Things changed when someone from Family Health Centers visited him in jail. They convinced him to enroll in a program run by the city attorney's office focused on breaking the cycle of incarceration for low-level drug offenders. When he was released, Moncada got a ride directly from jail to the health clinic. He says from there, they made it easy.
Their access was centralized, so they made my appointments with my therapist. They made my appointments with my psychologist. They made an appointment to get a physical, so I started getting back into the health plan. There's no way I would have picked up the phone at the time and been like, I need to make an appointment and I'm not going to stay on hold.
It's this kind of intense hand-holding that Moncada says helped him stick with his recovery. And it's the kind of work Family Health Centers will soon do more of, thanks to a $300,000 grant funded by California's cannabis taxes. The grants were promised as part of the 2016 ballot measure that legalized pot, and they're prioritized in communities most harmed by the nation's decades-long war on drugs. But despite sales of recreational pot being legal for 2 years, many of these programs have been delayed because of lack of funding.
The state is missing out on tremendous amounts of tax revenue.
Dallin Young is political director for the Association of Cannabis Professionals. The industry estimates up to 80% of California's pot retailers are unlicensed and untaxed. Young says the main reason for this are the bans or severe restrictions on legal sales imposed by local governments.
So right there, that creates a lot of access deserts, so patients cannot get access to any of these products because their jurisdictions don't allow them.
Cannabis shops are notoriously difficult and costly to open in San Diego. The city has fewer than 20 licensed retailers open for business. Denver has more than 8 times that number, with less than half of San Diego's population. Young says if San Diego wants more cannabis tax revenue, it has to allow more businesses to participate in the legal market.
I think that it's very prudent for our local governments to take out the moral judgment of whether or not cannabis is right or wrong, good or bad, and focus on the benefits that could be gained from this type of revenue that the state is going to be giving to these communities.
About that grant program, San Diego County did not compete very well. It received $1.25 million, or about 37 cents for every person in the county. Meanwhile, other large metro areas, including LA, Sacramento, and Oakland, got between 3 and 7 times as much money per capita. Dallin Young says local officials could have done more to drum up interest in the program.
We haven't seen quite the leadership that we need throughout the entire county to really inform the nonprofit groups that are doing the work that that grant program would facilitate with. They're not communicating with them, I don't feel like, and they're not really pushing them to apply for those grants.
A spokesperson for San Diego County's Public Health Department said the agency considered applying for the grants, but opted not to because of restrictions on how the money could be spent.
As soon as I took that first hit of marijuana, I knew I was an addict because it helped me with the struggle of losing my dad when I was a young kid.
David Moncada talks about how his path to addiction started with marijuana.
And then it progressed from smoking weed in high school to drinking alcohol in the high school. I had my first DUI when I was 18, underage drinking.
There's some irony in the fact that the legal cannabis industry is now funding programs to help people like Moncada stay off drugs. But Moncada is fine with it.
The funding should be there. You know, once the people get in recovery and they get stabilized, they're less likely to be offenses caused to get them incarcerated.
Tune in tomorrow for a look at cannabis equity programs, which aim to help disadvantaged populations share in the profits from legalized cannabis. Andrew Bowen, KPBS News.
The Hallmark Channel is known for its Christmas movies. Not controversy, but that changed over the weekend when the brand felt a backlash over an ad that depicts a same-sex wedding. John Lawrence has the details.
The Hallmark Channel divorces itself from a previous decision.
Do you think Zola could have made planning your perfect wedding easier?
We do. This commercial from wedding planner Zola, featuring 2 women exchanging wedding vows, was removed from the Hallmark Channel last week. This after Hallmark started facing pressure from the conservative group 1 Million Moms, who posted comments on their website like, "Shame on Hallmark for airing commercials with same-sex couples." However, on Sunday, after some were calling for advertisers and viewers to boycott Crown Media, Hallmark's parent company, the network annulled the decision on Zola.
We're talking to them. We've been talking to them all weekend because they want to do the right thing. And I think that the quick reversal is the right thing.
In a statement issued Sunday, Hallmark said it was truly sorry for the hurt and disappointment this has caused, and that it is committed to diversity and inclusion.
I hope people don't boycott Hallmark because I think they want to do the right thing and the good thing. And we're going to work with them very closely to make sure that they are truly inclusive and diverse.
The Hallmark Channel also said it'll work to reestablish its partnership with Zola. I'm John Lawrence reporting.
San Diego has seen basketball played on an aircraft carrier, and soon we'll see lacrosse on the Miramar flight line. The San Diego Seals announced today a special partnership with MCAS Miramar. Their game on February 22nd will be the Rumble on the Runway. The team will build a special playing surface and seating for military and season ticket holders. The Seals just started their second season in the National Lacrosse League.
I'm Judy Woodruff. Tonight on the NewsHour, new battle lines emerge as the House of Representatives prepares to impeach the president. Coming up at 7 after Evening Edition on KPBS.
A Central Arkansas infant born with a life-threatening genetic disorder gets a multi-million-dollar drug that could help save her. She's the first baby in the state whose insurance agreed to pay for it. Susan El-Khoury got to meet her today and the doctors at Children's Hospital who made this possible.
Hey, sis.
It's the little moments.
There's a smile.
That are now milestones as Casey Gilmore watches her daughter Josephine start to move in her hospital crib.
We're seeing her hands move again.
It might not look like much for an 8-month-old, but these are things doctors feared Josephine may never be able to do. She was born with spinal muscular atrophy, or SMA for short.
How could I let this happen to my kid? Like, why didn't I see the signs? Why didn't I know? But you don't know. There's not enough education about SMA and how horrible of a disease it is.
It's a rare genetic disorder where a person's nerves start dying before they're born.
They can't hold their head up. They can't move their legs. They can't move their arms.
The earlier doctors detect the disorder, the better the outcome. But many times, like with Josephine, it's not found until they're a few months old, and that can be too late.
6 months. Nearly 90% of the motor neurons in a child's body are dead.
There is a gene therapy drug. It's a one-time injection that costs over $2 million. Doctors call it life-saving.
The result that the nerve cells return to their normal health and return to their normal function.
A team at Children's Hospital got Medicaid to pay for Josephine's dose.
That's actually us holding the $1 million drug right there.
It's not an instant fix, meaning every day is a wait to see what happens.
We have a phrase around here, we're in Josephine's world and we live in it.
For her, and that will be one thing.
And getting that early treatment could soon be insured for more children. Arkansas is one of a handful of states that, as of next year, will require all infants to be tested at birth for SMA. You can find tonight's stories on our website, kpbs.org/evening edition. Thank you for joining us tonight. Have a great evening.